My name is Gio Nogales. I'm a paralegal here at Lyles Parker. Thank you for joining us for this new webinar series with the Home Care Association of Louisiana. To get us started today, we have Dr. Warren Aber. Dr. Warren Aber, DNPRN, a home health nurse since 1985 and has been the CEO of the Home Care Association of Louisiana since 1998. A diplomat nurse at 22, Herbert enrolled in Loyola, New Orleans at age 51, and 7 years later earned the Doctor of Nursing Practice degree. He then taught for 4 years at Loyola. Warren is now adjunct there and with the Rutgers Institute for Health, Healthcare Policy, and Aging Research. Dr. Herbert is on the American Academy of Nursing Expert Panel on Aging and chairs the Academy's New Home Health Work Group. Would you like to add anything, Mr. Warren?
No, thank you, Gio. We just want to thank Lyles Parker for the good work that you're doing in trying to get information out to home health providers here in our state in Louisiana, but also across the country. This topic is so vital for people that are going out and visiting patients in a home setting. And we're excited that we've got Richard and Les and the expertise they have on this particular topic. When we speak of violence in a healthcare setting, we need to recognize that we are engaging people at the most fragile, vulnerable moment of their lives. And in some cases with families who have loved ones that are dying, we are engaging them at the most critical moment of that person's life and engaging their family. It's important for us to know that as healthcare providers, there is not equality with regards to the knowledge that we have about what's going on with that person. And in those situations, it's very easy for patients and their families to see us in a position of power over them. And sometimes they can become defensive, and that can lead to some of the issues around violence. So again, Richard and Les have expertise in this area. This is a critical topic for all of us. We appreciate all of you joining us. Richard, thanks so much for being with us today.
Warren, I sure appreciate it. Hello, everyone. Welcome to all members of HCLA. We sure are proud to be here. And Warren, since you are in Louisiana, I just want to clarify, is it Warren Aber?
Yeah, thank you very much. Gio, I'm gonna work on the Hispanic pronunciations. And we yeah, it is Aber. Thank you, Richard, and thank you, Gio.
Yeah, no problem.
Let's go ahead and get started. We've got a few slides here, so I'm going to launch right in. And Les is he's got some other issues going on right now, family. So it's possible he might have been called away, but if he's able to make it, he'll join us a little bit later in the program. So let's go to the next slide, Gio, please. This is just a little disclaimer. It's general information. We're here to educate. We're not here to assess your situation. So if you do have a situation like this that you think is going to require legal assistance, contact a local healthcare attorney in your area. Our presentation today is going to be pretty straightforward. We're going to talk about how prevalent workplace violence is in healthcare settings, who commits it, examples in both the home health care setting, where it's violence against the workers themselves, and situations where we may have patient abuse. We're going to talk about prevention of violence during these home visits, and that's something that Warren just focused on at the beginning that we really want to bring attention to. What to do if violence appears imminent. There are things you can do to take steps to either try to lower the situation and bring down the heat or extricate yourself. Workplace violence prevention policies, that's something that's going on. We're going to talk about some of the legislation that's coming up because the federal government is working on some of that. It's still in the works. The House has passed it twice. The Senate hasn't yet, so we'll see what happens there. Nurses workplace violence prevention course. I'm sorry, we're going to talk about the elements of that prevention policy. And yikes is a little bit of a fun item there I want to focus on. Then we're going to talk about those changes in federal law, state law. We're going to use a couple of examples, Louisiana and Texas. Talk about the impact of COVID-19 and any subsequent pandemics that may come along. Tips to help you reduce risk, do's and don'ts, a simple yes, no sort of sheet for you. Some additional resources, and then we'll take questions, and hopefully I'll be able to get to all of this. So next slide, Gio, please. What is workplace violence? Well, OSHA describes it as any act or threat of physical violence, harassment, intimidation, or other threatening, disruptive behavior that occurs at the work site. It can affect and involve workers, clients, customers, and visitors. So what's a workplace? A workplace can be any location where an employee performs any work-related duty, including your office building or a patient's home. It can include related parking lots and travel to and from assignments. So when you're on the clock, that's workplace. Examples: verbal threats to inflict bodily harm, whether it's overt, covert, or it's just vague. Aggressive physical acts such as striking or pushing another person. Verbal harassment such as abusive or offensive language, gestures, other discourteous conduct towards supervisors, fellow employees, or the public. Disorderly conduct, shouting, throwing, pushing objects, punching walls, slamming doors. We all know what violence is. We're just trying to put it in a context here. Let's go to the next slide, Gio, please. So our introduction here, the 4 OSHA identified high-risk industries for workplace violence. Believe it or not, healthcare and social service workers come in at number 2. Correctional facilities, late-night retail establishments, bars, restaurants, places that tend to get robbed, taxi drivers. Those are your top 4. In January 2017, OSHA began inspections and issuing citations related to occupational exposure to workplace violence, focusing on these high-risk industries. And in May of 22, the National Nurses United website reported that in a national survey of more than 2,500 hospital nurses, more than 48% of the RNs reported either a small or significant increase in workplace violence since 2021. That's in the wake of COVID. And I don't think I'm telling anyone anything new here when they know that with COVID came an uptick in violence because everybody was homebound and because there was just so much more cabin fever going on. Next slide, please. There's a link and a site if you want to take a look at that survey. How prevalent is workplace violence in healthcare settings? Well, according to Lisa Tenney, who's an RN at Maryland Emergency Nurses Association, I've been bitten, kicked, punched, pushed, pinched, shoved, scratched, and spat upon. I've been bullied and called very ugly names. I've had my life, the life of my unborn child, and my other family members threatened, requiring security escort in my car. And it would not surprise me if you have members, Warren, that have suffered some or even all of these issues. It's commonplace, unfortunately. It's something that we have to plan for and deal with. The prevalence of workplace violence in healthcare is noted by a few things here. I want to give you some facts. On January 21st, 2022, the DOJ's National Center for Justice Bureau of Justice Statistics released a report entitled Indicators of Workplace Violence 2019 for the reporting period of 1992 to 2019. This report found that a total of almost 18,000 workers were victims of workplace violence, homicides between that period, and that's almost 30 years. However, the report also found that workplace homicides have fallen more than 50% from a high of 1,080 in 1994. So if there's some good news in this, actual homicides are down considerably in the last 30 years. But I think the trend for workplace violence has increased, as we're going to see. Next slide, please. Per OSHA, from 2002 to 2013, so in the last 10, 11 years, violence against healthcare workers accounted for nearly as many injuries as all other industries combined. And that's 4 times greater than the average U.S. worker. These figures underestimate overall workplace violence, since only assaults resulting in time away from work are reported. The number of assaults is considered greatly underreported because of fear of retaliation, unintentional assaults, persistent perception of workplace violence as part of the job, and fear of reporting that it'll reflect badly on their job, or even retaliation, which is illegal. Actual violence may be underreported by as much as 70%. Next slide, Chip. A CDC report found workplace violence nearly doubled for nurses and nurses' assistants in a 2-year period between 2012 and 2014. Nurses experienced more non-fatal incidents in workplace violence than against the police or correctional officers. Per the New England Journal of Medicine, there were 154 shootings with injury either inside or on the grounds of American hospitals between 2000 and 2011. And homicide is the leading cause of death in the workplace for nurses and employees in personal care facilities. Next slide, please. According to U.S. Department of Labor statistics, and we're kind of going through the tedium of federal statistics now and sort of giving you a framework to work with here. In 2021 to 22, the last couple of years, healthcare workers account for 73% of all non-fatal workplace injuries and illnesses due to violence in the U.S. prior to 2019. Unfortunately, the COVID pandemic has increased these incidents of workplace violence, and you guys have seen it out in the field. Verbal abuse, physical abuse, threats, stalking from patients, family members, or friends of the family are forms of workplace violence a healthcare worker may face. That's just the facts. Per OSHA, in 2018, approximately 75% of the reported workplace assaults took place in healthcare and social service settings. That's the Joint Commission alert on workplace prevention in healthcare workplace that was issued in 2018. Most common types of workplace violence in healthcare is patient visitor to worker. So it's not coming from the healthcare workers toward patients or family members. You guys are out there, for the most part, having to be aware and protect yourselves. And there's your citation. Next slide, please. Y'all are going to get a copy of this to look at in more detail if you want to follow any of the links or the resources and the additional resources that we've got at the end. Just wanted to kind of note these as we're going through. I'm not going to cover it in as much detail as on the sheet. For instance, this table, incidence rate and number of non-fatal occupational injuries and illnesses with days away from work resulting from workplace violence in the 5-year period of 2015-2019. I want you to take a look in the most recent group there, how the numbers have gone in healthcare support, nursing, psychiatric, home health aides. They count for 21%, which is higher, other than the 2017 number, but it went down 5 points in 2018, then it spiked up again during COVID. But the number to the right there in that first box, the number of incidents went from 5,800 to over 10,000. So it doubled. When you look at protective services down below, that's double what law enforcement faces. That's not good. So we got to do something to help you guys. Next slide, please. We take a look at it a little bit more. What we see here is that women are twice as likely as men to face workplace violence situations. That's as of 2019. And the older you are, the more likely you are to face this this type of violence, and that sort of makes sense because it goes along with your experience. When you're the difference from age 24 to 25, it triples, and it only goes down somewhat from almost 12,000 to 9,000 from the time you're 25 to 44. And then again, length of service, the longer you've been on the job, you know, after 3 months, your likelihood of encountering workplace violence is going to double. After the first year, it's going to double again. So it's not a question of if, it's really more a question of when. Next slide, please. So who commits workplace violence? I don't have to tell you guys. Violence by patients and their families. The perpetrator could be someone that's unhappy with the health care that's being received, either by themselves or the family member. It can come from family members or friends of employees or staff. Sometimes there's a personal relationship with an employee at a workplace. This can occur in cases of marital disputes or child custody situations, and sometimes it's just a stranger. Next slide, please. So if we're going to do a quote unquote profile of a perpetrator, try to get an idea. Many times it's a problem if you're talking about an employee, a problem employee with a history of conflict or threats against supervisors, coworkers, or employers. A lot of times it's a white male between 30 and 40 years old, history of violent behavior, exhibits paranoid behavior, responds negatively to criticism, signs of possible substance abuse, obsessed with guns, excessive interest in media reports of job-related violence, regular and or frequent complaints about poor working conditions or an unsatisfactory working environment. The individual may have an unstable family life and is frequently a loner. Now, the perpetrator doesn't have to have all these situations. It could be some or partial. The point is, these are traits or tendencies that we see recurring in folks that do commit this type of violence. Next slide, please. And a few years ago in 2015, the Texas Nurses Survey went out, and it wanted to know about types of violence and who it was committed against. Groups who committed types of violence in the past 12 months against Texas home health nurses, patients were the most commonly reported group, and family members or friends of patients were more often than other groups for each type of violence except physical violence. So apparently physical violence would come from the patients, but verbal, other types of abuse would come from family members of patients or friends of the patient. And that sort of makes sense. They're going to be the ones yelling for you to stop or, you know, get away or something like that. Next slide, please. What factors? Patient and home setting risk factors will include things like patients with a history of mental illness, violence, drug abuse, or alcohol abuse, working alone in patients' homes or a facility, poor emergency communications within the homes, which is why you got to have your cell phone with you, weapons among patients and their families, and neighborhoods with a high crime rate. Healthcare agency risk factors, lack of agency employee policies or staff training, things that will help you recognize and manage escalating hostile and assaultive behavior for patients, visitors, or staff. You learn to keep your head on a swivel like you do in a healthcare situation. You start looking for other factors, and I'm pretty sure that most of y'all have a pretty good radar when you feel things just aren't right. Pay attention to that. It's your instincts. They'll serve you well. Poor security staffing, lack of absence of restrictions of unauthorized access, and that could be signage and either electronic or physical barriers. No notice to staff, patients, families, and others that violence will not be tolerated. Be as simple as having a placard up in the waiting room area. And it is reported to police. In other words, you follow up. Your agency follows up if something happens. Next slide, please. Integra Service Connect failed to protect an employee from workplace violence. This is an example that happened in a home health care worker setting. Florida home health caseworker who'd previously apparently been documented that she was very uncomfortable in the home was stabbed to death by a patient. The patient had served for aggravated assault. Police had received 50, 60 calls on him in the last 6 years. They were well aware of him. OSHA found her employer knew the patient had a history of violence, criminal behavior, schizophrenia, and paranoia, but took no steps to protect its employee. Well, more than likely, that means training. That means awareness. It means giving her as much information as possible, giving her instructions what to do if she gets in a dangerous situation, try to extricate herself, trying to help the employee know what to do if things start going south. OSHA discovered multiple incidents when Integra employees were victims of verbal and physical threats from clients and concluded Integra did not conduct a hazard assessment of the service coordinator position or develop a written program to prevent workplace violence hazards. They just didn't address it. OSHA issued 2 serious citations with full penalties to Integra in March 2013 for failing to protect their employees from violence in the workplace and not reporting death to OSHA. What this comes out to is citations were over $10,000. OSHA is starting to enforce this, and OSHA has teeth. So there are enforcement agencies and avenues that the employee can turn to if there's a problem on the work site. And that's not just personal lawsuits and things like that, but you're talking about trying to remedy a situation from the employee point of view. Next slide, please. Another example, OSHA fined a national pediatric healthcare provider $98,000 for failing to protect home care worker from physical sexual assault. OSHA opened an investigation for an employee of And Venture Inc., doing business as Epic Health Services, when an employee was sexually assaulted by a home care client after the company had been warned by another employee of sexual assaults. It received numerous reports of verbal, physical, and sexual assaults on its employees, as well as a report of an employee forced to work in a house in which domestic violence occurred. OSHA cited the company for 1 violation related to employee exposure to workplace violence, including physical and sexual assault, and also for failing to record injuries properly on OSHA forms. So that's 2 examples where fines are being employed by federal agencies to try to address some of the aspect of having a workplace violence prevention policy, program, and training plan. Next slide, please. And finally, here's an example of patient abuse. In Oklahoma in December 2017, a home health aide was charged with murder after his patient died following an apparent assault. The aide admitted to hitting the patient 30 times with an open fist, squeezing his head and smacking him with a bag. In Texas, in March 2018, a Dallas home health aide was accused of fatally smothering an elderly woman and attempting to kill 2 others. North Texas police report over 750 unsolved deaths of older adults dating back to 2010. See if they might have a serial killer on their hands. Everybody knows it happens. If you follow up a situation, and you already know this, but if you were to follow up a situation, you see a patient of yours that looks like they've suffered abuse, and you question the family members or the spouse, and it just seems highly unlikely, then we have to consider the other source. And maybe you want to report that to your employer and see there might be another problem with an employee who has preceded you or another agency. Next slide, please. I think my partner here, Les, has joined us. He listed on here. You'll have to unmute your microphone there, Les. I hope things are going well for you. I sure do appreciate you taking time out to join us, and I will let you roll with the rest, folks.
All right, no problem. Thanks, Richard. Sorry for giving you a little scare this morning. We have twins on the way, so I'm constantly getting kind of pulled away for that. But I'm here, and we're going to go over some tips for preventing violence and some recent changes in law and a few deals related to kind of infection control. We're starting to get away from that, obviously, for good reasons. But you know, you never know when this will pop up again, anything like COVID. So the National Institute for Occupational Safety and Health provided tips for preventing violence during home visits and how to manage actual violent situations during home visits. So first tip was consider working with an escort in high crime areas, and if possible, schedule your visits during daylight hours. I'm sure most of y'all are doing that now to the extent that you can, but sometimes it's just not workable. So escorts, buddying up on visits, things like that can help a lot. Know the location and accurate directions to the patient home. You know, I guess the agency sometimes knows the locations in the area better than sometimes new employees who may not have even lived in the area long. So be sure you're aware of when you're sending your employees. Try to inform a coworker of your location and when to expect you to report back. If you're driving alone, keep your windows rolled up and doors locked. Always park in well-lit areas away from trees and shrubs and shadows, anything for a start. Keep healthcare equipment, supplies, and personal belongings locked out of sight in the trunk. I would add that, you know, before you open the trunk or get out of your, vehicle, you need to always check your location. So don't just look in your mirrors. Like, when you get to your rear of your vehicle, look around then too. If anytime you don't feel, you feel uneasy, just don't get out. Call your agency, call the patient or their family if they're, there, if they live there. Do anything you got to do, but sometimes those feelings at the pit, instead of their stomach are there for a reason. So let's go to the next slide. Doing your paperwork, documentation, calls inside, and then go to your car. So don't once you finish the visit, just do whatever you got to do. If you're going to do it in the car, do it in their house. It's a safer place to be. You can carry personal alarms and noise makers, I suppose, any other kind of self-protection devices. Don't ever carry a lot of cash on you. Always carry ID. I recommend making sure your cell phone battery is fully charged before visits. Again, stay in your car and contact your manager if you notice anything obvious as threatening your security, like gunshots, shouting, fighting, things like that. During the visit, use basic safety precautions. Evaluate each situation for possible violence and watch for signals of impending violent assaults. Any yelling, threatening behaviors, signs of just a dangerous environment, like signs of drug or alcohol, presence of weapons, anything like that, you should probably just go home. Notify your employer if you observe any unsecured weapons in the client's home. Obviously, in Louisiana, you're going to observe weapons on occasion. Hopefully they're in a gun case or hanging on the wall in a non-threatening manner. Go to the next slide. So more tips. Maintain behavior that helps diffuse anger by acknowledging the person's feelings, presenting a calm, caring attitude, not escalating. So don't try to match their threats, and ask questions and make suggestions. Don't give orders. I tell people all the time with any kind of situation where you're trying to de-escalate an angry patient or a family member or customer in other settings, to, if it's possible, take their side on it and just try to help them. That they're complaining about something that agency's not approving or payer's not approving or anything. Try to help them address their concern and get out of the situation. That's just basically acknowledging their feelings and suggesting, that we say contact the agency or let me help you get to the bottom of that. Just don't get into big arguments with them because you're out in the field and you're alone. Avoid any behaviors that may be interpreted as aggressive. Don't bow up to people or grab them by the arm and pull them around. Don't yell at any patients or their family. But otherwise, just act like a person who's dealing with strangers. Essentially, you don't know how someone's going to react, and you don't walk up to random strangers and start yelling at them. So just when you don't know how someone may react to you, you treat them with a little bit more care. You don't have to win an argument in their house. So if you are being verbally abused, just ask them to stop and leave if you can't get out of this situation. That's always really the answer. If there's anything that's escalating out of control, whether it's arguing or just odd behavior by their family members, you can just call the visit and go home.
Can I offer something?
Yeah.
That's such an important point. I'm so glad you focused on that, because, and Warren can tell you, folks have a point of professional pride. They want to try to finish the call. They may be under a lot of pressure from their agency to bill the visits and all that. It's not as important as your safety. If you're at risk, get out.
Mm-hmm. That's exactly right. And we say here, if you observe a crime, contact the police. Don't do it in front of people. Just extricate yourself from the situation, and contact the police, contact your employer, do whatever you got to do. But first and foremost, protect yourself and get yourself out of any situation that's appears to be dangerous or may become dangerous. Let's I guess go to the next slide. So, if violence appears imminent, I feel like we just repeat over some of these topics, but remain calm. If they're yelling or using abusive language, trying to speak in a measured tone, be respectful, even if they're angry or upset. Just do not engage in the same kind of conduct that they're engaging in. If they're escalating that argument, you de-escalate. Listen attentively. Avoid arguing or making statements that further anger them. Get help. So call your supervisor or coworker. If you brought someone with you, you can call for police or security, but that can also anger people. Frankly, there's no right answer to that. You're going to have to, kind of gauge the situation that you're dealing with. Definitely do not try to be a hero. The last thing anyone needs, the agency, the patients, healthcare community in general, is anyone to get hurt. And that's the patient or you. And, if you're not trying to de-escalate situations, you could get in a fight, a physical altercation with a patient, and either one of you could get hurt. And really, it could have all been avoided if you just de-escalated and left. None of that's a good outcome. Some people may be mentally ill, and the right clinical way of approaching the situation is, frankly, to leave and end the confrontation. So escaping is always the safest route out, really, because once you get out, you're out of the situation. You're no longer in danger, which is obvious, obviously. But it's something that people will, oftentimes when people do get harmed, it's because they're trying to remain and I guess fix the situation or argue with the patient or family member, and it never really works out all that well. Go to the next slide.
Les, while you're transitioning, this is Warren, if I might add, there's often a great deal of tension that exists within the family unit. So it may have nothing to do with what you're doing, but if you're in the setting and there is tension within the family unit and the potential for violence, it's still important that you extricate yourself if it looks like you're in danger. Thank you, Les. Yeah,
it's just, these aren't situations that we can't write a decision flow chart or anything that'll tell you exactly how to respond to any situation. But what we do know is that if you are able to remove yourself and leave, then you're good. So really, it should be your fallback. You have other methods of de-escalating and trying to empathize with patients, but in the end, getting out is your best bet if things really go south. So they did a survey of home health nurses in Texas in 2015, and they were discussing what kind of workplace violence prevention policies are in place in their agencies. So just, I guess, reading the tea leaves around the rest of the industry, it looked like 71% had implemented workplace violence prevention policy. 73% are doing training on it. 66% conduct risk assessment of their work areas. 87% require reporting of incidents. 92% investigate reported incidents. Now, this is obviously surveys, so whether they do that constantly or continually update their risk assessments and all that is a completely different story. But it's you see that a decent amount, even back in 2015, we're starting to do that. We need more. Obviously, you need more. Say 90% have policies or 100%, but it's something that's expected, and even in relatively low numbers, like 66% doing a risk assessment, if you didn't do one at all, you're going to stand out. Let's maybe move on to the next slide. This is again from the survey. So this is the employers offering refresher training to nurses. So 66% offered workplace violence awareness training. 48% were offering training on de-escalation techniques. 45% offered training on specific evasion techniques. 49% on containment measures, and 57% on identifying characteristics associated with aggressive and violent behavior. You know, there's obviously a million different topics you can go over and you know, de-escalation, evasion techniques, containment measures, identifying, you know, violent characteristics. The key is, I think, just continually trying to make people aware. Even if you're not training about, you know, let's say an incident happens next week to one of your nurses, you may have never done a training on that exact topic or anything that would prevent that directly, or that, you know, educated them on how to prevent that situation. But just an overall organizational kind of focus on workplace violence prevention and response techniques it creates a culture of, I guess, being aware and being careful. And that's really what you want to achieve. There's no way for anyone to predict what trainings will actually help someone in a given month. But if you're continually focusing on it as an organization, your employees will focus on it as well. And so they'll all keep their guard up a little bit better. Let's go to the next slide. Okay. So elements to include in your workplace violence prevention policy. So obviously a basic management commitment and employee involvement. Everyone's part of this. So you're trying to create a true organizational culture where everyone's safety is part of your main focus. You have a policy statement. You assign a threat assessment team. You do a workplace risk analysis. So that's, you know, basically just looking at all the places you do business and or you provide services, and trying to come up with what, you know, your team thinks is risky about each place. Obviously, lots of times it's just going to be an individual home in the country, but sometimes it's apartment complexes, and it may be, I don't know, safer to park in the front and walk through the middle of the apartment complex rather than pull into the back. Every place could be different, but you need your on the ground team to help kind of help you conduct that analysis and come up with a plan for each location. You want to evaluate your program. You want to have training and documented trainings. Your incident response, active shooters policy. This is more of just a emergency response policy, but record keeping is key. I know this is just one more thing for y'all to keep records on, but every time that someone, I guess, let's say you have an employee who's attacked in a patient's home and then ends up suing, regardless of the facts of what policies you've had in place, that suit is going to have to basically allege that you've continually been put on notice of these problems and you've done nothing about it. If you're not documenting how you respond to employee complaints about patients and routinely doing it, where we can see a good solid record of every time someone complains, there's an incident report made, there's a plan of action, you know, some kind of a recommendation. if you don't have that kind of record keeping, they're going to be able to make that argument whether you do it or not. I mean, you could easily take each little complaint and have a meeting with a whole team of people in someone's office. But if you're not, and you can do that every single time, but if you're not documenting it, you're not going to be able to prove that, or no one's going to believe you in court. So record keeping is key for keeping OSHA off your back, keeping lawyers off your back, and just, I think also the formality of it will help you to, I guess, convince the employees that the whole organization is really truly committed to this. So let's move on to the next slide. So they have a workplace violence prevention course. It's interactive course, highlights real life workplace violence incidents. It's intended for healthcare professionals, nurses, physicians, et cetera, but it's available for anyone. It's 13 modules and they're about 15 minutes each. There's a link to the course there on the slide. I haven't looked at it. I'm sure it's pretty corny. All of these things probably are, but you know, it's still helpful. And I guess having a policy where they have to do this kind of training and other trainings, really it's more than about just that particular training and its worth. It's about, you know, an organizational commitment to safety. So let's go to the next slide. All right, so it is no joke. And so, you know, this is basically just a slide about how some people got in trouble, or how you can get in trouble for joking around about this stuff. Now, I don't know if that'll actually happen in your practice. I don't know if OSHA will, you know, will find you, but they have it in their contract, even if in bolded language, even if intended in jest. So you cannot have any threats of any kind if you're a primary home care provider. And that's really across the board, though, and that's why we have a TSA example in here about a 49ers player in 2014 joked about a bomb in an airport. It's a workplace violence is frankly a serious thing, serious matter, and it's got to be taken seriously, even if the trainings are corny. And they probably, again, always will be. But you know, we've got a school shooting, just what was it, yesterday. This is across the board in every kind of setting there is. There's always a possibility for violence, and there could be deaths on occasion. And the last thing you want to do is be, you know, look like you're not taking it seriously, because it's very serious, and serious enough to be put into contracts and result in fines and, I guess, criminal charges for jokes on occasion. But everyone needs to take it seriously and just, you know, don't joke about it as an organization or as an employee. Just, you know, everyone take prevention measures, you know, given the seriousness that they deserve. Let's go to the next slide. So recent changes in federal law. So this is pending. This is HR 1195, Workplace Violence Prevention for Healthcare and Social Services Workers Act. Passed the House, got more support. Senate hasn't voted for it yet. White House supports it. Bill mandates healthcare and similar organizations provide annual workplace violence training to employees and staff. I would suggest more than just annual and maybe smaller. You don't have to do 2-hour long trainings, but just continually train. They're going to require at least an annual training. Require that you investigate violent incidents. Everyone should be doing that anyway. Develop violence prevention plans that include risk assessment, hazard correction, and infrastructure upgrades. So it'd be like your exits, your doors, your locks, things like that. Maybe lights outside, if you have a facility, obviously. Maintain and retain your related records for at least 5 years. Report and evaluate information as required by OSHA 2016 guidelines for preventing workplace violence for healthcare and social service workers, which were recommended. Management commitment, employee participation, worksite risk analysis, tracking and trending, hazard prevention and control, safety and health training, record keeping, and program evaluation. You can see this is all, it's all the same recommendations over and over and over, because, well, frankly, some recommendations you can have in this situation. But, you know, it's important. It's becoming law, and in a lot of cases is already law. But everything is just ramping up a little bit more and you want to be with the crowd and not sticking out the other way. So let's go on to the next slide. It's basically formalizing some of this. So the Lynn Truxillo, okay, so in May 2019, an RN at Baton Rouge General, finishing her shift when a patient became violent and attacked a colleague. She stepped in and was a victim herself and died. Now, I don't want to say that you shouldn't help out a coworker, and so this really isn't about whether or not you should have stepped in. Obviously, help people when you can, but it's about increasing penalties on employers for not preventing workplace violence, and penalties on people who commit workplace violence as well. So, like against healthcare providers. So in 2022, I asked the Lynn Truxillo Act, which established duties and requirements for healthcare facilities. It's got several different provisions, but you have to have signage, which is now required. Public resources are made available to us. You have to have a prevention plan, policy, education, training, and response. There's reporting required, and there's an anti-retaliation provision in here. So you can't retaliate against someone for reporting workplace violence. Also passed in July was Legislative Act 129, which just revised simple assault or battery on ER personnel, emergency services, or any kind of healthcare professional. So it's pretty much everyone on your staff is now it's a felony. So no longer a misdemeanor. And you now also have a new crime of unlawful disruption of the operation of a healthcare facility. So this is in part in response to COVID stuff as well, with anything that becomes political, I guess, can seem just a healthcare issue to you, and all of a sudden it's a big problem for your operations. With protesters outside, it really doesn't matter what your position is on any of those issues, but you can have issues that are external to your organization that cause a whole lot of problems on the inside. And we saw that with mask policies and opposition to that. We've seen it with other things in the past. We've seen it with abortion providers. They deal with issues like that. Catholic health providers deal with issues like that sometimes when people are angry at the Catholic Church. So, it's not always internal things. It's not always just your patients. It can be something entirely external, like legislation or politics, that can, I guess, increase the risk for your team. But now assault and battery on any of your team members is a felony, and hopefully that'll help. I'm not sure that laws have helped that much in the past, but let's go to the next slide. We can all hope. Okay, so the signage is required. You can download it from DHH's website. It's pretty straightforward. Abuse of our workplace violence against healthcare staff is not tolerated and could result in a felony conviction under RS 1438 or other applicable criminal laws. Nice little logo. It's easy peasy. I like it when they give you the notices. You go to the next slide. Texas. So Texas passed 2 significant changes to its sexual harassment law coverage in 2021. So I covered this before, but and SB 45 was effective September 1st, 2021, and expanded the definition of an employer to include individuals and business entities of any size, which basically expanded the potential liability to every Texas employer. So whether you're a sole practitioner or a much larger business with more than 15 employees, you're all still subject to the same liability now for sexual harassment. Let's go to maybe the next one. Not sure how many we have. So, okay, so also in Texas, employee time to report a sexual harassment incident to the Workforce Commission is increased from 180 days to 300 days, so basically 10 months now, from the day that the alleged conduct occurred. So it's not when, I guess, necessarily when they reported it to you. I guess it would be the date of the incident. Let's see. They revised the labor code for liability if there's a claim for sexual harassment and the employer knows or should have known that the conduct was occurring and fails to take immediate and appropriate corrective action. This is similar to what I was saying earlier about wanting to document your workplace violence responses and how you handle each incident. You obviously want to do that with sexual harassment complaints as well. Every single time someone complains about a coworker or anyone else sexually harassing them, you need to document that complaint, your investigation, and any response or mitigating measures that you took. And you want to basically just kind of create a long record of having done that in every conceivable situation, so that someone looking from the outside can tell that if someone had actually complained about something, it would be in the form of a report, because you always make a report of it. That's the kind of documentation you're trying to create. It's a record over time of continually investigating things and taking appropriate actions. While they don't define what corrective action you should take, administrative policy changes, training, retraining are examples. Basically, you want to have something you're doing each time, and obviously you want to be effective, so you don't just do things just to do something. But anti-harassment training, regular workplace social interaction training, it's really, there's not a whole lot of things you can do other than separate people. You can send people home. You can, there's a whole list of different things you can do, but it's about being consistent and that you do something each time. Regular updates to your compliance plan and training should be made to incorporate any legislative or regulatory changes in the workplace. So just basically just keep up with new changes like this. Sometimes they're relaxing things, sometimes they're becoming more strict. So you just have to keep up with it. Let's go to the next slide. COVID. So COVID's kind of starting to end, but what I've been telling my wife since the beginning of this thing is, whatever the truth is on pretty much any statement that anyone's made, eventually the data will show us the truth. It may take decades, but they're collecting so much information on COVID that it's probably more data than we ever collected on any illness in the history of mankind. But so we're starting to see a lot of big, large systemic meta-analysis reviews. There was one in May 30th, 2022 that basically just confirmed, suspicions of increased workplace violence against healthcare workers inside and outside of the hospital setting during COVID pandemic. Obviously, we could see it with our eyes, but when the data stacks up and becomes, 10 miles high of paper, eventually you're going to know exactly what amount of increase there was. So they concluded that they possibly deprived some of the quality nursing care, caused psychological stresses among healthcare workers, and possibly endangered subpatients' lives by increasing the risk of medication errors. So this is just basically fear can impact your team. So that can be one of the downsides of not having effective workplace violence practices, is your team could be working scared and actually not perform as well. So therefore, it's necessary to protect healthcare workers and proactive measures to protect them in similar cases in the future. All of this benefits your organization. You don't want people, you don't want chaos at the front door, and you don't want people practicing defensive medicine. Any kind of fear can cause you to change your clinical behaviors, and that's really just never a good idea. So workers may be threatened and assaulted as businesses try to put in place COVID or the next disease prevention policies and practices. So it's like mask policies, social distancing, and they can come from customers, employees, employers. And there was a 1996 current intelligence bulletin that threats and assaults can happen in any workplace, but maybe more likely in retail, services, and other customer client-based businesses, which kind of is what you're in. So go to the next slide. So more tips. So this would apply to, this is for COVID stuff, but we never know what'll come down the road later. So there's a new disease that comes around and we have to put in place all kinds of policies again. You can offer your customers options to minimize their contact with others, promote social distancing. These can include curbside pickup, personal shoppers, home delivery for groceries, things like that. With you're going to have to come in, frankly, but like lots of healthcare providers, we're able to do telehealth, and that would be an example of this. Post signs that Let your customers know about policies for wearing masks, social distancing, and maximum number of people allowed in the business facility. Provide employee training on threat recognition, conflict resolution, nonviolent response, and any other topics. Put in place steps to assess and respond to workplace violence, remain aware of and support employees and customers if a threatening or violent situation occurs. Assign 2 workers to work as a team to encourage COVID-19 prevention policies be followed if staffing permits. Install security systems, train employees how to use them. Cameras don't do any good if they're never turned on. Identify a safe area for employees to go if they feel they're in danger, so especially a safe room. You know, with COVID, a lot of things were, I guess, creating a hassle on your workflow and creating stressors inside the organization, angry patients on the outside. You know, getting everyone to just kind of keep a level head is, I think, one of the keys. You know, panicking, just what your position is in any argument or anything just doesn't really, frankly, matter. Whatever you're arguing about usually doesn't matter. Since feelings usually get into anger or turn arguments into angry arguments. But, you know, I guess what I try to get across to people is, or our staff is, you know, if you can, and it's possible, if someone comes up and they're griping about mask policies, even if you don't agree with them, you know, try agreeing with them. Like, yeah, I know this is stupid, but the government makes us do it. Even if you don't believe it, it doesn't really matter, because getting past that situation is much more important than either winning an argument with them or even, frankly, teaching them anything. Go to the next slide. Do's and don'ts. Do attend all employer-provided trainings on how to recognize and avoid and respond to potentially violent situations. Do report perceived threats of violence, threats or acts of violence to your manager, supervisor, and, you know, following any policies that you have in place. Remain aware of and support coworkers and customers if there's a threatening or violent situation. Do not argue with customers if they make threats or become violent. If necessary, go to a safe area. Don't try to force anyone who appears upset or violent to follow COVID prevention policies or policies related to COVID or new disease in the future. You know, I'd agree with them if you can. Don't, you know, just do not argue with people about any of this stuff, really. If someone comes up and they're angry and they're griping about some infection control policy, it's not really about that. They're just angry about something else. So don't engage in the argument with them. And you know, maybe if possible, act like you agree with them and blame someone else, blame the big bad government for making us do it. Whatever you got to do, just don't get them angry with you. It doesn't help anyone. So, go to the next slide. So here's some additional resources. OSHA guidelines for preventing workplace and healthcare and social workers, roadmap for healthcare facilities, something called the big pictures, lots of different things. So Department of Health, OSHA, all have lots of different workplace violence. So JCO, CARF, all kinds of other accreditation bodies as well also have them. There was an Oregon HCLA study in 2015 on workplace violence against hunger workers and its relationship. You can check that out. 2 links there. And how many more slides do we have? We're getting really close to that. Go to the next slide. Oh, I knew we were getting close to the end. I just felt it coming. All right, so that concludes the presentation. So if you have any questions or concerns, feel free to voice them now or email them, I mean.
Les, I had something to offer here. One of the things while you were talking about all this, I wanted to be sure and mention is that
Hello, Richard?
I think it got dropped.
Yeah, I think
sorry, my sound went out.
Oh, okay.
Can you hear me now?
Yep. Go ahead.
Okay, sorry. I was saying there's something fighter pilots call situational awareness, and for the healthcare industry, And obviously, it takes years to develop this, but it's about keeping your head on a swivel. And when you're young, I know the tendency is to focus on the job, focus on the patient, this and that. But for you experienced RNs and therapists, folks who've been out there a while, you know that you have to be aware of everything. So one of the things you can do during the training sessions that your company and agency provides is have sharing between your vets, your experienced folks, and your young folks. If you don't have the staff available to team them up, then make that exchange. Talk about situations you've been in. Share the knowledge. That's really something you've got to take advantage of, because y'all are out there and all you've got is each other.
It looks like we don't have any questions that the viewers have posted. So I'm just going to end it here. So thank you all for joining us today, and hope to see you all in the next webinar for Home Care Association of Louisiana. Have a great Tuesday.
Thank you, Richard, Les, and Gio. On behalf of the Home Care
Thank you,
Association.
Les. Appreciate everybody at HCLA.
All right. Bye, everybody.
Thank you.
Thanks, everyone. Just in case anyone's still on here, we appreciate you guys at Lyles Parker. Take care.